Good morning, everyone, and welcome to our fall Medicaid fair today. We're very excited to get back and face-to-face, being this our first hybrid fair, so excited you came out with us today. And for those of you that are joining us virtually, thank you for joining us as well. Our first presenter will be Commissioner Kaylee Nagel with the Department of Community Health, and I'd like to introduce her first, and she'll tell us a few words of encouragement of what's going on in Medicaid today, and then we'll get on to the following opening session. Commissioner Cagle.
Thank you. Thank you, Cheryl. Good morning, everyone. It's great to see you. Having lived in a virtual world for the past couple of years, especially at DCH, it's so refreshing to be in person with all of you. And of course, welcome to everyone that's joining us online virtually as well. Hope to see you as well soon. Again, my name is Kaylee Nagel. I'm the Commissioner of the Department of Community Health. Thank you for being here. Our mission is to promote and increase access to health care for Georgians, and we're just the middleman. We can't do that without our providers, without our partners, and without our employees and staff and the healthcare industry around the state that helps us actually deliver those services. So thank you for everything that you do. Thank you for being committed to our mission that helps serve, ultimately, us serve the same population. So we're happy that you're here to join us today. I'm not going to steal Lynette's thunder, our Medicaid director, the rest of the team that's here, and the folks that you'll hear from today. But there's a lot on the horizon in the next year or so in our world, in the Medicaid world. A lot of topics you guys are probably very familiar with and watching related to the public health emergency unwinding, Medicaid redeterminations, our upcoming significant reprocurements that'll change the landscape of managed care in Georgia for the next foreseeable future, and excited to share some other updates that you'll learn about today. But we're excited that you're here, that you're our partners. I hope that over the past year or so you have found the department to be transparent, accountable, willing to listen, and I hope that we're meeting your needs. And if that's ever not the case, I hope that you know that you can reach out to Lynette, to me, to our staff. I'll give you my phone number. You can email me directly, and you will get a response. So we don't always have the answer that everyone wants, but we're certainly always willing to listen and take a look. So again, thank you for letting me be here with you today. I'm excited to sit into some sessions and learn with you and get to know a few of you, but proud to call you our partners in achieving our mission. So thank you so much. Cheryl, thank you.
Thank you, Commissioner Nagel. We appreciate you being with us today. My name is Cheryl Collier, and I'm the account executive responsible for the healthcare business in Georgia under direct contract with the Department of Community Health. Some of the things that are coming soon with you, and you probably heard something about them, we're having our multi-factor authentication. We've held 20 workshops virtually over the last month, so hopefully some of you have been able to attend those. We also have workshops, additional ones in the month of November, where we'll have 20 more. We'll get a little deeper into what is MFA. That's going to be your new acronym. This enhancement will assist with security as far as your offices and your clinics, things of that nature. So please plan on, if you haven't already attended, one of those sessions in November. If you attended them in October, it's very important for you to attend them in November as well, because we're doing a building block type training, you know, the introduction, the next steps, etc. This will be a rollout across the state, statewide, based on the alphabet of your provider number. So it will be a gradual over 3 months. So look forward to you guys attending that. And we do have some websites here on the slide that you can use to get better understanding of that. Next thing we want to talk about is Gabby. If you called into our IVR and you've had a virtual agent attend, she has a very nice voice. When I first heard her, I thought she was a person. So she's gaining in popularity. She's handling about 20% of the calls through that virtual agent. She's open 7 by 24. She never takes a break. She never has a bad day. So if you have an opportunity, try her out. If you see things that are, as you're going through Gabby, please, that you'd like to see as an improvement or things we could do differently with Gabby, please let us know, because she's very flexible. as far as workflow and that type thing. So please, I encourage you to give us those ideas so we can continue to improve her. Well, here's some things that Gabby does for us. She can do eligibility, she can check eligibility, application services, claim statuses, prior authorization, payment information, and re-credentialing. She can help with all those things. And we'll continue to make her smarter and smarter as we get feedback from you. You need assistance? I'd like to introduce you to our provider relations team, and I'll ask them to stand and wave so you'll get a face. So hopefully they'll be out after we get through this rollout of PHE and things back off on that perspective. We'll be able to get out in your offices like we did prior to the pandemic. First person is in Territory 1. This is North Georgia. This is Mercedes Liddell. In Territory 2, which is Fulton County, Deandra Murray. Okay. What are you trying to tell me? On maternity leave. Okay, thank you. My apologies. Territory 3 in Northeast Georgia, we have Carolyn Smith. Territory 4, that's Northwest Georgia, Tiara Johnson. Territory 5, which is the Southeast metropolitan area, Ebony Hill. Territory 6, which is Middle Georgia, Chantel Bradshaw. Territory 7, Augusta, Jessica Bowen. Territory 8, that's Southwest Georgia, Jill McCrary. Territory 9, Southeast Georgia, Kendall Telfair. Territory 10, South Georgia, Anitris Johnson. And then for our hospital reps in the South, we have Janie Griffith Weaver. And on the hospitals rep for the North, we have Sharidra Bentley. So thank you. That's all of our loving and smiling faces for provider relations, and they look forward to helping you. We also have provider relations field service representatives. These are our in-house reps that assist on the phone as well as work in concert with your provider rep in the field. We have Chastity Bartlett, LaTanya Durden, Crystal Gordon, Haley Guyton, Brandon Stewart, Kaylin White. Okay. We also have statewide consultants. These are provider enrollment and CVO field reps and our statewide consultants. On our statewide consultants, we have Sheree Daniels, Brenda Hewlett, and Danny Williams. On the provider enrollment CVO field reps, we have Darlene Bonner for the South, Auburn Woods from the North. I'd like to share with you who our current leadership group is over provider relations. Our provider relations manager is Anita Hester. And our provider relations supervisor, Sharana Strong. So if you're looking for a way to contact your rep, we have on here the website, etc., and Welcome to Georgia, where you can contact your rep directly. And these are some more contact information, just a slideshow of how to contact us. And this will be available to you, all this, and you don't have to write it down. And there's more these are more screenshots of how you're going through that connection. I'd like to share with you some metrics that we have gathered from April 1 of 22 to October 1, just to give you a feel for the inventory, how do we process claims, et cetera. So on the provider relations team, from an outreach perspective, we've had 7,582 contacts. These are via emails, phones, virtual workshops, and virtual visits. From the contact center, we've received over 497,000 calls, and our correspondence and web portal requests are over 5,800. From a provider enrollment perspective, we're currently processing applications within 11 days of receipt, and CVO is within 15 days. We've received over 15,000 applications and approved a little over 9,700 applications. From a revalidation perspective, we've received 7,500, and we've approved 6,876 of those. From a resolution and adjustments, we're currently processing adjustments within 1 day of receipt. We've also processed from a cash receipts and paper adjustments a little over 3,000 in this time period, and suspended claims and processed a little over 84,000. From information that's received through our mailroom, we've had a big number, 2,300,000 and above on outgoing letters mailed. Number of publications mailed, a little over 67,000, and the total claims data capture, a little over 4,800. A few reminders before I introduce our next speaker. All our presentations will be uploaded to the GA MMIS web portal by close of business tomorrow, and our sessions, frequently asked questions and answers, will be loaded within 2 weeks. For access to the presentations and frequently asked questions, you'll see using your normal site, www.mmis.georgia.gov. Some Medicaid resources that we'd really like for you to pay attention to, if at all possible, or share with your teams when you get back to your locations, is our banner messages. Banner messages is one of the most important ways of finding out what's happening immediately or any upcoming changes, training, etc. So make sure you're reviewing those banner messages, sharing them with your office staff, etc., so they'll know how to act on those new, latest and greatest things coming up. We also have, at the agency, they have a newsletter, and we have their website here. And if you'd like to subscribe or request to be added, there's a link following this comment. So please get involved with that newsletter. Lots of good information on upcoming events and things that are going on. I really appreciate, again, your attendance today. I'd like to introduce to you Lynette Rhodes. She's the Medicaid Director with the Department of Community Health, and she has a wealth of information. So Lynette, it's all yours.
So good morning, everyone. Thank you, Cheryl. Thank you, Commissioner. Again, my name is Lynette Rhodes, and I am the Executive Director for the Medical Assistance Plans Division. I want to thank each and every one of you for coming out today. This is our first hybrid session. And I was asking Cheryl this morning, I said, it's been a long time since we've been in person. When was the last, I couldn't remember. I was like, when was the last in-person Medicaid fair? And she reminded me it was the fall of 2019. So it has been quite a while. So it is good to be in the presence of people. It's good to see each of you. Hopefully, as we continue going forward, we'll start to see more people attend and appear in person. If this is your first time attending one of our Medicaid fairs, we do hope that you find the information to be informative. We're available to answer any questions that you have. I just want to encourage you to attend as many sessions as you can this morning. For today's agenda, we are going to do a review of our current priorities, our procurements, updates on enrollment trends, and we'll close out with expenditures, and then a live poll. So if you're new to the Medicaid space, or if this is your first time attending, we are the Department of Community Health, and we administer the Medicaid and Peach Care for Kids programs in the state of Georgia. And we do operate 2 service delivery systems. One is fee-for-service and one is managed care. And you may be asking, well, what are the differences? It's really the populations that are served and who's actually managing the care for those individuals. The individuals that typically receive service under fee-for-service are going to be our aged, blind, and disabled members. Also, we have children who are in our Georgia pediatric program, and also members who receive services under our 1915C waivers. And those, for example, be the ICWP waiver, which is our independent care waiver, the new options and comprehensive supports waiver, and also CCSP and source waivers. So those are our members who receive services in the home and community-based setting. In the managed care space, the individuals who receive services are receiving those services through one of our 3 managed care entities, and they are Amerigroup, CareSource, and Peach State Health Plan. And they do have representation and representatives that are here today to assist you if you have any questions or concerns. The population of people that typically receive services in the managed care setting are going to be our Peach Care for Kids members, which are our CHIP members, our low-income family members, newborns, children under age 19, and pregnant women. So those are going to be the populations that receive services in the managed care setting. Shifting towards our current priorities, as Commissioner Noggle mentioned in her introductory remarks, we have several that are ongoing. So we're just going to highlight a few for you here this morning. But the first main priority that I want to spend a little time on this morning is COVID-19 and the public health emergency. And so that is one of our primary priorities that we're working through. We continue to navigate the impacts of COVID-19 on our Medicaid and CHIP populations. Our main priority is ensuring that those members continue to have access to services. And as most of you are aware, over the past 2 years, we've put in place and implemented a number of policy changes, one of the primary ones being the expansion of telehealth, which has served both our members and providers very well. We implemented a number of waivers and flexibilities to assist both providers and members. And now we're at a point where we're shifting the focus to preparing for the unwinding or the end of the public health emergency, and I'll talk a little bit about that more in just a moment. Next is reducing maternal mortality and morbidity. We have some exciting news to report on that front, some good news that we got from CMS last week. So we'll talk a little bit about that. Electronic visit verification. And while we have implemented phase 1 successfully, we are now shifting our focus to phase 2. So I want to talk about that a little bit. And then the upcoming changes related to our Medicaid Management Information System, which is commonly referred to as either GAMIS or MMIS. All right, so public health emergency. So a lot that's going on here. I'm certain that most of you are aware that the public health emergency is currently scheduled to end January the 15th, mid-January of 2023. That is the last update that we have received from the Department of Health and Human Services. And while I wish that we had a crystal ball and could say for certain that this will be the last extension, we can't do that. But what we're hearing is that this will most likely be the last extension that we receive in terms of the public health emergency. And so what that means is this will end mid-January of 2023. And so I want to talk about what that means for you as providers and what that means for our members. We have been working very closely with CMS over the last few months to prepare for the end of the public health emergency. The primary focus has been on making sure that we can contact our members when the public health emergency ends, because we will begin the redetermination process, and I'll talk about that in just a moment. We've also focused on our communications efforts and making sure that both providers and members are aware of what's occurring. And we've also looked at our system changes, because while we've put in place a number of waivers and flexibilities, we will now have to go back and undo or unwind many of those. In terms of our communications plan, we have worked very closely with our sister agency, the Department of Human Services and the Division of Family and Children Services, on a communication plan. We have entered into a contract with a PR firm, a public relations firm, to help us get the word out about the public health emergency, the upcoming redetermination process, and what members will need to do. We have developed an unwinding partner toolkit, and we're going to need some help from you as providers to help spread the word. And we have established, through our sister agency, a website. And I want to make sure that everyone makes note of this today. We've established a website, and that is staycovered.georgia.gov. Again, I want to repeat that. staycovered.georgia.gov. This is the website that contains a host of information about the redetermination process, the end of the PHE, what members will need to do in order to update their contact information. And so it is vital that you as providers are aware of this website. It is vital that you take the opportunity to go and access and review the information on the website and share this information with your patients, with our members, with your staff as well. So if you have not seen our mascot, this is George A. Peach. And so George A. Peach is our mascot. You may have seen some of the commercials, the ads, or you may have seen it come through your Facebook page. So if you go to the staycovered.georgia.gov website, you're going to see George A. Peach. We've prepared a couple of commercials and ads, but this is an example of one of the pages that you will see on the staycovered.georgia website. And this is a part of the communications plan that we're pushing out to members. We're telling them that big changes may be coming to your Medicaid coverage, and these are the steps that you need to take. So in terms of timeline, I want to talk about what's happened thus far and what the next steps will be. So over the past several months, we have strongly encouraged members to go out to the Gateway website and update their contact information. This is so critical and vital because we have to be able to reach members when we begin the redetermination process. Keep in mind, it's been 2 years since we've contacted a number of these members. Remember, since March of 2020, we have not terminated any members from the Medicaid rolls or from the Peach Care for Kids rolls. And so communications with members has not really been ongoing. Our care management organizations, of course, have been in touch with the members, but from an eligibility and enrollment status, we've not had any contact with the members because nobody's been terminated. We've allowed them to remain on the roll. So from an eligibility standpoint, we now need to make sure that we can reach our members. 2 years is a long time. Members have relocated to new addresses, they've changed phone numbers, they have new email accounts. And so over the past several months, the focus has been getting members to go into the Gateway system and update their addresses. Starting this month, the focus is going to shift a little bit. And so, yes, we still want members to go in and update their address, but now the focus is on getting members to understand that the public health emergency is coming to an end in January. We need them to know that January the 15th is when the PHE ends, and starting that month, immediately thereafter in February, we will begin the redetermination process. In January of 2023, we will also shift the messaging to then start to explain to members the redetermination process and what that entails and what that looks like. So again, that is all a part of our communications plan. So number one, getting members to go in and update their contact information. And we not only want mailing addresses, we want phone numbers, landline numbers, mobile numbers, email addresses. Then again, starting this month, shifting the messaging to informing members that the PHE will be ending in January. And then in January, shifting the messaging to informing folks about their upcoming redetermination process. If you go to the statecovered.georgia.gov website, you will see information that informs members on how to update their contact information. So there are clear instructions that are listed on the website. So again, please be sure to direct your members to the statecovered.georgia.gov webpage. We've also included on the website some frequently asked questions, and I've just pulled up a few here just to demonstrate to you what those look like. You know, what is Medicaid? Who's eligible? Is Medicaid ending? And when will the federal government end the COVID public health emergency? These are also a few examples. So here we get into what is a Medicaid redetermination? What does that look like? And what happens if I am no longer eligible for Medicaid? So as you can see, there's a lot of vital information that is on the statecovered.georgia.gov webpage that will be very informative and helpful to you as providers and also to our members. So providers, partners, stakeholders, we need your help spreading the word. We cannot do this without you. This is vital. So the first thing here that we're asking your help with is directing members to the staycovered.georgia.gov webpage. Please direct your members and your patients and your staff to this website. Number two, remind your members to update their contact information. And this is done through gateway.georgia.gov. So this is where they go to enroll, this is where they go to submit applications, but we want you all to remind them to go and update their contact information. And then share images, tell them about George A. Peach, share the videos, share all of the information that you're going to learn today and going forward about the Medicaid unwinding and the end of the PHE. So how will the member redeterminations be processed? And I think a starting point is, for those of you who may not know what a redetermination is, I'll take just a moment to explain that. Each year, on an annual basis, we have to look to see if the members continue to be eligible for Medicaid. So we look at various components. We look at their income. We look at what assets, what resources they have. And this is all a part of the redetermination process to ensure that our members continue to be eligible to receive Medicaid and Peach Care for Kids services. So that is the redetermination process. And that has been on hold and not done since March of 2020 because of the public health emergency. Once the PHE ends in January, starting February the 1st, we will begin the redetermination process. So we will then start looking at the members to determine if they are still eligible and still able to remain on Medicaid. We will utilize the full 12 to 14 months that are allowed by CMS. So per CMS guidance, we must initiate initiate all redeterminations within a 12-month period. CMS has granted us an additional two months, which will carry it out to 14 months total to complete the redeterminations. So we are going to take full advantage of that total time period to allow us to get through all of those annual redeterminations. To help streamline the process, we are going to align those redeterminations with SNAP and TANF renewals. So for example, if we have a Medicaid member who is also receiving SNAP benefits, we're going to do those at the same time. That way we don't have to keep touching that member's case multiple times. So we're going to streamline it and align them so that if you're in more than one program, we're only going to look at you once to make sure that you're eligible across the board. And finally, many members will retain their current annual redetermination dates. So that's a question that I get quite a bit, which is that, well, how are you going to do it? Are you going to change the dates for everybody? Is everybody going to get new dates? No. To the extent that we can handle those redeterminations based upon their current redetermination dates, that's when they will be done. So as an example, if you have member John Doe and their anniversary date or redetermination date in the past was June, then they will continue to stay on the rolls after the PHE ends until June when we look at them. And then we'll determine, does John Doe meet all of the requirements to remain eligible? If he does, then he will continue to be enrolled in Medicaid. If he does not, then we will follow our normal process, which is to issue a written letter to the member informing him or her that they are no longer eligible for Medicaid. They will have our typical standard due process rights or appeal rights, and then they will be transitioned to the marketplace. And that's the normal process that we follow. We're not changing that, but that is what will happen once the PHE ends. What will change at the end of the PHE for providers? So as you all are aware, at the start of the public health emergency, there were a number of flexibilities and waivers that we put in place that will end at the end of the public health emergency. And I wanted to make sure to talk about this today with providers. So number one, provider revalidation. And so Cheryl talked about this a little bit in her introduction today. We have not required providers to revalidate, although we have strongly encouraged providers to go out and complete the revalidation process. So once the PHE ends, we will go back to mandating providers to revalidate. And remember, federal regulations require this to be done once every 5 years. Now that we credential, we're requiring it once every 3 years. So we try to align revalidation with your credentialing efforts and recredentialing efforts. So I did want to just remind you all, if you have not revalidated, please do so. Because once that PHE ends on January the 15th, this will no longer be optional. It will be a mandatory requirement. Site visits will resume. So for those new providers who are, reapplying or applying for the first time, we will reinstitute site visits. All prior authorization requirements will resume. So there were a number of changes that we made with respect to prior authorizations. Those will then automatically resume. Application fees will be reinstated. Pre-admission screening and annual resident review, level 1 and level 2 assessments will resume. And the provision of services in alternative settings will end. So that's one thing that will end, is the provision of services in alternative settings. So those were the highlights that I wanted to share this morning with respect to the public health emergency. So I think your key takeaways are, number one, the website. What is it? Y'all remember? staycovered.georgia.gov. Please, please, please help to get the word out. Share it with your staff, share it with your patients, share it with your members so that everyone is aware of that website so that they can go there and obtain vital information. Shifting now to maternal mortality and morbidity. As you guys are aware, this has been an issue in Georgia, an area of concern for many, many years, and not just Georgia, but other states as well. A little over a year ago, we implemented an 1115 postpartum waiver to extend postpartum services to 6 months. And we were only one of 3 states to do this nationwide, so we were super proud of that. So we went from 60 days to 6 months for postpartum services. Well, I am very excited to announce that under Commissioner Nagel's leadership, we submitted a request to CMS to extend postpartum services to 12 months, and we got approval last week. So effective November 1st, yesterday, Georgia will now be providing 12 months of postpartum services. So we are joining the ranks with a few other states nationwide and are super excited about this. So by extending postpartum services to 12 months, this will ensure that we're able to provide enhanced care coordination, that we can monitor and track, our mothers and make sure that they're getting the care and services that they need. And I'll also mention that the 12 months postpartum will be provided regardless of if there's a change in circumstances in that mother's income or status. So once they're on, they are on and will receive these services for 12 months. So congratulations to all those at the DCH team, and thank you, Commissioner Nagel, for your leadership. Along with that extension of to 12 months, we will now slowly work to transition and phase out the 1115 postpartum waiver. So we've got some more work to do there with CMS. We'll have to give notifications out to our members, but it's good notice, right? So it's saying, hey, we don't need this anymore. We now provide 12 months of postpartum services. So we will be working to transition and phase out of the 1115 waiver. And the last benefit that I wanted to mention here that relates to postpartum coverage, that's not true. It's one more thing I'll mention. But the resource mother component. So each of our care management organizations provides services through what we call a resource mother. And these are individuals who help to connect our mothers to services in the community. They help them to schedule appointments, schedule non-emergency transportation, help them to connect to other vital community services such as SNAP or TANF or any other services that they need. So this is something that we do that's unique in Georgia, and we will continue to provide the resource mother component. The other thing that comes to mind is lactation consultants. So for those of you who are not aware, we now enroll as a new provider type in the Georgia Medicaid program, lactation consultants. So that was approved by CMS a couple of months ago, so we're super excited about that. So there is a huge amount of focus again on addressing maternal mortality and morbidity. Next, I want to shift to another one of our current priorities, and that is electronic visit verification. I do want to start out by giving a huge kudos to Brian Dowd, who is our Deputy Executive Director. And Brian, if you could raise your hand for me, I know you're out here. And so for those of you who are not aware, Brian Dowd led the effort to establish EVV in the state of Georgia. It was a labor of love. That's the best way I can describe it. I think he's been working on this probably since 2018. And so electronic visit verification is mandated by the 21st Century Cures Act. It is a federal law and federal requirement. And it allows us to basically confirm that services are being provided to members. So this is the type of service, who's receiving the services, who's providing it, the date, the time, and location. And it is a way to help reduce fraud and abuse. So I am excited to announce that for phase 1, which applied to personal support services, we are certified by CMS. We have gotten our certification. So we are now shifting to phase 2 of this implementation, which will apply to our home health service providers. If you have not attended one of Brian Dowd's town hall sessions, you are missing out. So if you are a personal support provider or a home services provider, I strongly encourage you to stay tuned to the banner messages so that you can be informed about any upcoming town hall sessions that Brian Dowd will be hosting. Next update is the Medicaid Management Information System. So we've been reporting this out to you guys for a while now. This is the behemoth project and procurement that we're working through, and it consists of multiple stages and phases. And so we are now in a position where we're working through the provider module. So we have contracted with a new vendor, that's CNSI, and they will actually operate for us the provider module. So that work is in development. We're in the design, development, and implementation stage. So we will continue to keep you all posted. So what does this mean for you? It means that there are some changes that are coming as it relates to the MMIS and the GAMMA system. We're not there yet, so don't panic, don't worry. We have plenty of time to get there, but there are going to be some changes in terms of how the system operates, what you see, what you'll have to do to go in and submit applications, and we'll train all of our providers when the time comes. Again, this is a little ways off, but just want to start messaging it now just to get it on your radar, but stay tuned for more information there. In terms of procurements, Commissioner Noggle mentioned the care management organization procurement. So as you know, today we have, again, 3 care management organizations: Amerigroup, CareSource, and Peach State Health Plan. We are now working on our next CMO procurement. And on average, it takes us about 2 years to get through one of those, so it's a pretty lengthy process. We have secured a consultant to help us with this work and also outside counsel. So we'll keep you posted in terms of the status. Lots of moving parts there, but just want you to know that we're procuring those contracts for the Georgia Families and the Georgia Families 360 programs. So we'll keep you posted. We are also working on our fee-for-service pharmacy benefit manager procurement, and this is what we're calling a NASPO procurement, which is a nationwide where other states can join in, and we are leading that effort. So just want to say kudos to Peter D'Alba, who is our Director of Pharmacy, who's working diligently on our PBM project, and then, of course, the MMIS procurement. In terms of enrollment trends, I thought it'd be interesting for you to see kind of where we were back in March of 2020 and where we are today. So as you can see, in March of 2020, we were at 2.1 million members that we were serving, and that's combined Peach Care for Kids and Medicaid. As of September 30th, we are at 2.7 million members. So the roles have continued to grow. And again, that's in part because we've not terminated any members from the roles since March of 2020. Of that 2.7 million members, 2.1 of them are receiving services and care through our care management organizations, and the remaining 600,000 members fall in that fee-for-service bucket that I described earlier. So the 600,000 represents those who are aged, blind, disabled, or waiver recipients, or perhaps even members on our Georgia Pediatric Program. In terms of expenditures, just wanted to give you a glance. So we just closed out state fiscal year 2022 And so when you look at the cost that we've spent, and this is across the board, state fiscal year 22 for Medicaid. This is just for Medicaid. The shaded area that's in light blue represents what we've paid combined total to our care management organizations. So you'll see that light blue shaded area where it says capitation payments. So that is the money that we paid out to our care management organizations to provide services and manage the care of our members. The other areas that are shaded in the different colors, the lavender, brown, purple, those costs and expenditures represent the fee-for-service population. And so there's a recurring theme here that we've seen in past years, which is that while the fee-for-service population is our smallest, and remember, they're the 600,000 that I just spoke about, they are the most expensive. And that has been the trend and continues to be the trend, and that's demonstrated here when you look at the expenditures on the fee-for-service side of the house. So here we've listed for you pharmacy services, nursing home services, hospital, and our waiver program recipients. For state fiscal year 22, we've also identified all of our expenditures for Peach Care for Kids. And what's different here is the majority of the chart is in light blue, which is again represents capitated payments that we've made to our managed care entities. And this is because the majority of our Peach Care for Kids members are served through a managed care model. So we only have very few Peach Care for Kids members who are in fee-for-service. Typically, these are going to be children who are deemed disabled. And so you'll see the costs there are much smaller as compared to what we're paying to our care management organizations. So just wanted to remind you guys of all of the breakout sessions that we have today. EVV, our care management organization, provider appeals and common denials, COVID-19, and that's preparing for the end of the public health emergency, nursing home hospice services. We have a session today on quality, and we also have a session today on legislative changes. So if you can stick around and hang out with us to the end, that legislative session, that last session on legislative changes is definitely a great one to attend. It's something new that we've added this year because we thought folks would want to know, what were the changes and requirements that came from this year's legislative session? What was the department required to do? And so Brandy Sylvan will be updating you on those changes. So before we end and before I close out, we wanted to do a poll. Make sure I'm doing this right. And so we did this back in fall of 2019, I think, and it went over pretty well. So we thought we'd try it again. So you have to log on to the mentimeter.com. Let's see. And use the code 72220564. So you do this on your phone. So if you have your smartphones, if you could take those out and go to www.menti.com and use the code 72220564. So for those of you who are participating remotely, you can also log on as well. Again, I'll give you that website, www.menti.com, and the code is 72220564. All right, so Cheryl, I'm stuck. Let's see. Let me try. All right. For fun, which team is the best Georgia team? The Georgia Bulldogs, the Atlanta Braves, the Atlanta Hawks, the Atlanta Falcons. And I'm probably going to get in trouble for this because Commissioner Noggle went to, was it Arkansas? University of Arkansas. We're going to get that on there next time. So it looks like the Georgia Bulldogs are coming in strong, and Atlanta Braves a close second. All right. Of the options below, what best describes you and your provider organization? So are you a nursing home provider, physician, behavioral health, waiver provider, pharmacy? We just want to get a better idea of who's in attendance for today's fair. Okay, so a lot falling in the other category. But thank you for those of you who are attending from our behavioral health providers, our waivers, physicians, nursing homes, and hospitals. We got to get some folks here from dental and vision. We got to get the dental people here. Number 3, rate your experience with Peach State Health Plan over the last year. Excellent, good, fair, needs improvement, or poor. We want you to be honest. We want to know what your experience is with our care management organizations. And we need this feedback so that we'll know from you, how things are going. Okay? So we've got a little work to do here. Needs improvement, lot for good. Rate your experience with CareSource over the last year. Again, honest feedback so we'll know how things are going. Okay? Good feedback here. So a lot in the needs improvement area, a lot of good, but a lot of needs improvement as well. Rate your experience with Amerigroup over the last year. Okay. In terms of administrative simplification, where do you and your organization have the most challenges? So this is going to be a narrative, so we won't see the bar graphs here. What we want you to do is to write in a narrative where you're experiencing challenges in terms of administrative simplification. So are there policies and procedures that you feel like are administratively burdensome? If so, capture those in the comments. We would like to take those back to our care management organizations and also to our state leadership. So that concludes our live poll for today. Thank you again for attending today's opening session. And so we're going to adjourn this session, and you guys can now proceed and move forward to the various breakout sessions. Thank you again for your attendance.